Hi, I'm Dr. Leonard Kiridimas. I'm an orthopedic hip surgeon in Port Huron, Michigan. Here today to talk to you about hip arthroscopy. Since the 70s, we've been able to perform arthroscopic surgery, which is basically poking small holes around a joint and going in there with a small camera and instruments that allow us to work in that joint. And in the early 70s, actually, we started doing that with knees. Somewhere in the 90s, we started doing that with shoulders, and it wasn't until recently, the past several years, that we've been able to go into the actual hip joint and perform arthroscopic surgery. So people can have problems in their hip that are amendable or treated with arthroscopic surgery. People can have mild, moderate, even more significant arthritis that we can go in there and sort of clean that up a little bit, where previously you really didn't have any options like that. People can have cartilage tears in their hip joint. Basically, it's a cartilage that surrounds the edge of the cup, the acetabulum, that can tear as a traumatic event or just wear and tear over time. Traditionally, you weren't able to do anything about those tears. Nowadays, we can go in there with a small camera, a small scope, outpatient arthroscopic surgery, and repair that cartilage. Sometimes if it's too torn up, you have to remove it, but we certainly always try to repair that. There are bony lesions that can create impingement or pain in the hip. Hip impingement is typically caused by spurs off of the edge of the socket or small prominent areas off the femoral head of the ball, and they can cause a pinching, locking, or give out sensation in the hip. And traditionally, again, for those, you weren't able to do anything about them other than pain medication and just kind of live with it. Nowadays, we go in there arthroscopically, 2 to 3 little poke holes, small camera, and remove those small spurs. Arthroscopic hip surgery, you go into the hospital, we typically put you to sleep, we poke little holes around the hip, 2 or 3 of them, go in there with a small camera, do the work. Remove the arthritis, repair or remove the torn cartilage, remove the spurs, all arthroscopically. You go home the same day. Using crutches for several days, typically recover fairly quickly within a couple of weeks, 2 to 4 weeks depending on the problem. You're getting around pretty good. Maybe not resuming full activity for up to 6 weeks, but certainly a lot better than just living with your pain and discomfort. If you have hip pain, I would recommend seeing somebody for it. And certainly, I perform arthroscopic hip surgery right here in Port Huron, Michigan. I'm Leonard Kiridimas, and thank you for watching my video.